Good morning. My name is Kristen of Refine from Within. I'm a psychotherapist and a health coach, and I'm here to share with you today why psychotherapy doesn't necessarily always work for everyone. So I'm going to pull aside the curtain and let you in on some of the inside knowledge. Now, for some of us who have emotional issues or maybe aren't feeling the way that you want to, you move towards a psychotherapist as a means of feeling better. But there are so many other areas of wellness that go into a healthy lifestyle. And can that even be addressed in a psychotherapist's office? There's the mindset piece. How you think is what you believe, and then will change your actions and will change how the outcome of your life becomes. So if your mindset is off, can that be treated in a psychotherapist chair? What if your motivation is off? What if you know what you should do, but you don't actually have the motivation to get there or to do it? What if it doesn't take into account movement? Physical movement is such an important part of our wellness, whether that means movement throughout the day or even no movement at all, such as meditation or breathing. Fueling and nutrition are so important to wellness. How we eat is how we feel, and how we feel sometimes guides our food choices. And that can really change our overall health or wellness. And then finally, guidance. How do we stay on track when regular life pops up? We all have stress. We all have things that are reaching and grabbing for our time. How do we stay on track when we need that little bit of guidance? Now, I don't want to say that all therapy is wrong or bad, but I want to show sides to the therapy interaction that I don't think are working so well. And I have been a psychotherapist and in the field for over 25 years. I find that psychotherapy has a one-dimensional approach that looks really just at your emotions, your thoughts, and your feelings. And that can take a really long time for people to process that, which results in clients feeling frustrated and then can cause actual further difficulty emotionally or mentally. Therapy also makes the therapist the quote unquote expert. And therefore, the client only feels that they can make growth or change when they are sitting in the therapist chair. If you're only meeting with your therapist once a week, once every other week, or maybe even once a month, where does that change happen independently in your own life? And then also, when therapy doesn't take a whole body approach to functioning, like I mentioned before, with fueling and movement and motivation and mindset, it can just feel like endless talking with very few wins and movement towards that motivation. So as a psychotherapist and a health coach, I want to be able to differentiate between the two, because it's really important so that you can understand that there are differences as well as overlaps. Now, in psychotherapy, it's more of an open-ended process. When I interact with my clients, I usually start with, what brings you here? What are some changes that you'd like to see? But as we continue to talk and process, there is more of an exploration, and things usually go a little bit deeper and more than what they just initially came to see me for. It's an open-ended process. It's usually a longer term working together. I have some clients that I've seen for the entire pandemic, 2 years, and some people that will come in and just see me for a few weeks or a few months at a time. But also there are people who are really seeking that longer working relationship, and psychotherapy can give them that. How does coaching differentiate? Coaching is very solution focused. People will come to me and say, I need to lose 10 pounds for my upcoming high school reunion. I want to get there. How can I do it? They're very solution focused. They have a goal. They're very outcome oriented. They say, I have X amount of time. This is what I really want to do. Can you help me get there? They usually have a shorter time frame. It's not open-ended as it can be in psychotherapy. And these people, they want action and they want it now. They want a plan. They want me to show them how to do things and how to create change in their life. But I don't want to talk about just what I can do. I want to show you through one woman's story. We will call her Deborah. Now, Deborah came into my psychotherapy office clinically diagnosed with depression and anxiety. Depression and anxiety are the two most common diagnoses for adults in the United States today. Now, she, a few months after working with me, she went to her annual medical exam, where her doctor just threw up the red flags, giving her warnings, saying that if she did not lose 20 pounds in the next year, she was going to be at risk for pre-diabetes, fatty liver disease, and possibly cardiac issues. This was a woman in her early 50s. He gave her a financial incentive that if she were to lose the 20 pounds in 1 year, she would get a, I think it was a $50 Visa gift card. This was something that was going through her office or health insurance at that time. Literally, I kid you not, wrote on a prescription pad, lose 20 pounds in 1 year, handed it to her, and that was what she brought into my office. She was very upset, didn't know how to do this. She was literally given a piece of paper. At that time, she was working 40 or 50 hours a week at a sedentary desk job. She lived at that time in an emotionally abusive relationship, and she coped with calorie-dense foods. Dinner for her was sometimes a snack box of, what were they called? Ho-hos, ring dings, those sort of snack cakes. This was how she coped with the emotional stress in her life. She did little to no exercise, a sedentary work life, and had been a lifelong smoker and had no idea how to quit. So I said, you know what, I'm going to put my coaching hat on and let me see how I can interact with her. And I said, what do you want to see differently in your life? And this is what she said. She wants to feel better, not to be so tired all the time. She wanted to have more energy for her life, for her children and her grandkids. She said she didn't want to be that kind of grandmother who sat in a chair and watched life go by. She said she didn't want to be fat, her words. And from that, I was able to derive that she had low self-esteem and low self-worth, and we needed to work on that. She was also very fearful of disease and wanted to avoid that. Now, if I had taken the traditional psychotherapy route, I would have stayed right here in the depression and anxiety and would have worked here on the emotionally abusive relationship, leaving everything else to work on for her. But here's what the coach did. So I came in and worked with her. Instead of focusing on her diagnosis, I said, let's identify where your emotional triggers are. This way you can be able to determine when these triggers arise in your life and how you can reroute. We talked about the goals for her medical exam, those red flag warnings, and reframed it as an opportunity for her to start her life over. Not only did she lose 20 pounds in 1 year, she lost 50 pounds in 18 months and kept it off. Fantastic. Very proud of her for that. She finally left that desk job that had been driving her nowhere for so many years and took on a new career as a real estate broker. Fabulous. She loved it. She left that relationship and for the first time in her life at the age of 55 became a homeowner. She custom built her own house. She was very proud of it and put every room, every wall, everything exactly where she wanted to. Instead of doing the calorie-dense foods, I talked to her about how to eat and shop around the outside of the supermarket, how to exchange certain foods, how to understand that her choices were emotionally based rather than nutritionally based. She went from doing no exercise to walking every single day after work, and she loved it. She created a walking club with her girlfriends. She also finally quit smoking for the very first time in her life, and that was something we really didn't work on much at all, other than for her to say she felt better and wanted to continue to do so. And she knew the cigarettes were not helping her. Now, why is health coaching essential now? You know, as we have seen, the need for mental health and supportive services over the pandemic has done nothing but increase. That makes a lot of sense, seeing all the stress that's out there. But also seeking help has become more normalized. You've seen in social media as well as on the news some famous names: Simone Biles, Michael Phelps, Naomi Osaka. These are all sports people, but these are also people who are very visible with their mental health struggles, and they're asking for help, and they're making it okay. Health coaching is a $7 billion with a B dollar industry. This is not a fluke. It is not a fad. It is not going away. When people search for health coaching, the number 4 search that they look for is mental health coach. They understand the need for psychology to go along with their wellness. They're looking for it. They are seeking it out. And when you match a health coach with someone coming from the medical side of things, a study found that patients recently discharged from a medical inpatient facility, when they were aided with health coaches to help them stay healthy while at their home, they were able to save $412 per month per patient in healthcare costs. So how can you help today? You can visit and follow my social media. I'm on Instagram to build awareness and appreciation for this modality. Health coaching is a new phase but it's something that's very essential and very important. You can join me on Clubhouse. I have interesting talks there each and every week, speaking about mental health, health coaching, and overall wellness. And we'll talk a little bit more about this later in terms of referrals for corporate wellness directors. But that is my presentation here today. I'd like to thank Christina Grove for inviting me, and to 1 Million Cups for this opportunity to share something I'm very passionate about. Thank you.